Bismillah walhamdulillah wassalatu wassalamu ala rasulillah. Today we are going to talk about the stroke. So we'll take some video and we'll make explanation.
That was a fun family get together. Did you enjoy it?
Why, yes. It was nice having everyone together.
Yes, it was.
I especially like the fact that John and Diane drove in from out of town.
As you see, she feel weakness on the right side, weakness in the arm and the leg, and her daughter help her to sit.
Understand me? Can you talk? Well, John, there's something wrong with Mom. I don't know what's going on. I was in the kitchen. I was washing dishes. We were talking. All of a sudden, she could barely stand up, and I can't understand a word she's trying to say. A stroke.
Stroke، جلطة في الدماغ. البنت بدأت تتصل على الأمبولانس. She called emergency medical service in the Kingdom of Saudi Arabia 997, in America 911. So she has to call and she has to explain what is the signs for her mother.
We think my mom might have had a stroke. Just a few minutes ago.
This is the emergency medical service. She is receiving the call and she will send the ambulance, taking the data from the caller, from her daughter, okay? And she will send the ambulance to the place.
Hospital personnel must generally administer intravenous fibrinolytic treatment. Patients with acute stroke need 8 Ds of stroke care. Patients with acute ischemic stroke.
Do you have any pain in your chest or your back? No? Are you having any trouble breathing?
بيسألها طبعا عن التنفس. He's asking her about her breathing.
Or having seizures?
Okay.
When EMS crews arrive, they should perform a brief medical history and, if allowed by protocol,
هياخد طبعا الميديكال history. He will take the medical history for the patient if she has she's diabetic or not.
Cincinnati pre-hospital stroke scale.
Pre-hospital Cincinnati scale. This is the scale will be taken for the patient of stroke before going to the hospital.
Grace, can you smile for me?
You see, she cannot smile. One facial drop,
Facial droop is present.
facial drop,
Patient's face does
right side facial drop.
the other side.
Mrs. Breeze, can I get you to close both eyes and try to hold your arms out straight?
See, he's asking her to move her arm draft. She cannot even hold the arm draft, and weakness on the right side. Total weakness, arm draft, facial drop.
Now can I get you to repeat something?
Abnormal speech, she cannot talk.
Can I teach an old bonding tricks?
She cannot speak, abnormal speech. Yes.
Thank you.
He's asking about the time because suppose within 3 hours she has to be transferred to the hospital to take the fibrinolytics.
Over 110. Her heart rate is 110. Respirations are 14, and her pulse oximetry is 95%.
This is the vital signs: blood pressure 140 over 110 and heart rate 110.
Why not Memorial?
And they are checking the blood glucose, it is normal.
Mrs. Breeze, we're going to take you to the hospital so you can get checked out, okay?
They will transfer her to the hospital.
Of opportunity for fibrinolytic therapy.
Her heart rate is 110 and her respiratory rate is 14 without difficulty breathing. Blood glucose level and pulse oximetry readings are within all limits.
It's very important to check the blood glucose because the hypoglycemia could make some signs. Sometimes we are confused that this is a stroke or hypoglycemia. So you have to be sure that the blood glucose is normal. So they are waiting the patient and they will receive the patient from the door. So they are receiving the patient on the door. They will make evaluation. Within 10 minutes, they have to start to make evaluation, ABC, airway, breathing, and circulation.
In addition, PD personnel should
They have to evaluate the vital signs, and they have to give oxygen if the saturation less than 94, and they have to start the yes, they have to do investigation. They will attach 12 leads ECG, and they will make neurological assessment, and they have to do CT scan, must be as soon as possible. And you have to collect the data to determine this is ischemic stroke or hemorrhagic stroke. This is a neurology consultant.
I understand that you're having trouble speaking, but I do need to ask you a few questions.
He's asking here about any numbness or weakness on the right side. He has to recheck for the patient for the signs of stroke to be sure this is stroke. She cannot answer the doctor. He is asking, he is making physical examination. He will check her arm. Cannot elevate her arm draft. She cannot elevate her arm. Okay, right side. Weakness on the right side, totally weakness on the right side. Even the leg she cannot move. So it is confirmed this is a stroke. They have to start the fibrinolytics as soon as possible. He's asking about the time. She's telling him exact time, start the symptoms, because they have to start the fibrinolytics within 3 hours. He's asking the nurse to check the vital signs.
CT notified before the patient arrived?
Yes, we notified them as soon as he hit this call. They're ready for it now.
Let's get Mrs. Priest down, all right?
Okay.
CT scan supposed to be done within 25 minutes of arrival in the hospital, and the report will be completed within 45 minutes from arrival to the hospital. You have to confirm this is ischemic stroke or hemorrhagic stroke. If hemorrhagic stroke, neurologist consultant, she's the one will manage, or he is the one will manage this case. If ischemic, they have to decide, take decision. They are sure it is ischemic stroke, so they have to take decision for using of fibrinolytic, and they will make checklist, and they will repeat the neurological examination. Okay. The time is very important. Suppose less than 3 hours. He's explaining the result and the report of the CT scan, and he's telling here it is ischemic stroke, and suppose they have to start the medication, the fibrinolytics, as soon as possible. Again, the physician doing examination for the patient to check her leg and her arm. Still weakness. Still there is a stroke. She asked her to read. Abnormal speech, she cannot read. She explained the report of the CT scan. She's telling it is ischemic stroke. This is the result. That's why you have these symptoms, and we have to start the medication. And they will ask her to sign consent for the fibrinolytics, because there is around 3 to 5% of the bleeding, cerebral bleeding could be happen. There is a checklist. She's checking if the patient has any history of taking any medication. The blood pressure 190 over 140, so they will give medication for adjusting the blood pressure. They will start to give medication, and they have to take the consent of the patient and his family, because the liability of cerebral bleeding. Cerebral hemorrhage could be happen. The patient agree. Started fibrinolytics within 3 hours of the symptoms. Must control the blood glucose level, blood pressure and temperature. This is the final day disposition of the patient. The patient will be transferred to the stroke unit. Okay. For the best practice of the stroke care. There is 8 Ds for stroke care: detection, detect the sign and symptom; dispatch, delivery; door, data; decision, drugs, this position. This is the 8 days of stroke care. Now the patient taking the fibrinolytics, and she will start her rehabilitation because of the weakness of the right leg and hand. Now the patient is okay, taking around 1 to 3 months. She's better because they transfer her immediately within 3 hours to the hospital to take the fibrinolytics and to make the CT scan. At the end of this video, thank you very much. Just we are trying to give a small video about stroke care. Okay, this video taken from American Heart Association. Thank you very much.